The Ghana International School Delegation presents Open Defecation in Ghana.
Improper waste disposal is a dumping of waste in ways that might be detrimental to the environment. The world generates about 2.01 billion tons of waste annually, and 33% of that figure is managed wrongly. The dumping of refuse in Ghana has increased significantly in urban areas due to rural-urban migration. It is especially common in low-income households that are not able to pay for their waste to be collected. This leads them to dump their waste in public areas and gutters. One of the major factors contributing to improper waste disposal is open defecation. It affects about 1 billion people worldwide and about 220 million people in sub-Saharan Africa. Open defecation is so extensive in Ghana that almost 5 million Ghanaians openly defecate. It is especially rampant in the northern regions of Ghana where there is less of urbanization, and this costs the Ghanaian government about $79 million annually.
Such a problem in the form of open defecation on waste management in Ghana, there are many causes which should be brought to the attention of most if we indeed want to tackle the issue at hand. One major cause of open defecation is the lack of public latrines in communities, most especially rural areas where this discourageable trend mostly takes place. With no trace of latrines in those areas, inhabitants living in those communities are made to go in unsanitary places, for example, nearby water bodies. Even if some latrines are available, most come with the cost that people in the rural areas of Ghana may not be able to pay, making them believe the better and cheaper option is to go in open areas, making this a norm for people to do. Another cause of open defecation is the huge non-enforcement of laws pertaining to the open defecation. Even though there are laws for such an offense, the punishment may not be as severe as other environmental offenses. This allows people to do this and get away scot-free without any repercussions. To add to the causes, a major cause indeed is the lack of education on the negatives of defecating in the open. People may not understand the diseases or other ailments that come with this issue. Diseases such as cholera and tapeworm can be caused from excreting in the open.
Why do people defecate in the open?
Sometimes we don't have toilet facilities, and when you even get it, they take money. And because we don't have money, we just find someone backyard and do it and be free. Sometimes seaside, you do it and be free.
The situation of open defecation is being addressed by the government and has allowed many private businesses to fund and invest in projects that involve public toilet or latrine management services. However, such services are not appropriate for low-income areas that large trucks cannot easily access at times. Sadly, sanitation has not really been a public funding priority, and households bear the bulk of the cost. Therefore, open defecation is not at fault to business practices and actually tends to make a positive influence on the current situation. It is estimated that Ghana loses about $79 million on average annually due to open defecation, according to GhanaWeb.com. This means that the country loses a lot of money due to poor sanitation, especially due to open defecation. This has a negative effect on the economy, as this produces an opportunity cost scenario where money that could have been used to improve literacy rate, crime rate, etc. is now used to fix the issue of open defecation. Therefore, we as a country give up the benefits we could have gained from other resources.
Moving on to the social impacts of open defecation in Ghana. Open defecation has proven to be a critical health challenge, and a large number of people die yearly from sanitation-related illnesses, several related to diarrhea, cholera, typhoid, and many more. And this is as a result of the lack of toilet facilities in many rural and urban areas around Ghana, leading to people defecating in the open, with children leading the practice, leading to a high child mortality rate. In the Wa municipality, for example, 52% of the households do not have toilets at home. Human feces are thus found in open spaces and sometimes in between houses, surrounded by their stench and flies, thus destroying the beauty of the area. The environment is also seriously affected by open defecation. Toxins and bacteria are introduced into the ecosystems in such large quantities that they eventually end up in water bodies, thereby causing harm to aquatic life and even leading to eutrophication. A perfect example of this is the Kole Lagoon in Ghana, which is situated in an area where open defecation is common. The lagoon is now a victim of the effects of open defecation and has been reported to have not been able to support aquatic life in recent years.